Depression can be a challenging and complex experience, not only for the individual affected but also for their loved ones. If you have a family member who is struggling with depression, it is crucial to understand the condition, its impact, and how you can provide support. This article aims to guide you through the process of dealing with a depressed family member, offering insights into recognizing the signs, fostering effective communication, and creating a nurturing environment. Additionally, we will explore the importance of professional help, self-care for caregivers, and building a strong support network. By equipping yourself with knowledge and practical strategies, you can play a vital role in helping your loved one navigate their journey towards healing and recovery. 1. Understanding depression. Causes, symptoms, and impact. 1. The causes of depression. Depression isn't something that can be easily pinned down to one cause like a bad haircut or an expired carton of milk. It's more like a cocktail of genetic, biological, environmental, and psychological factors that come together to create a perfect storm of sadness. So while you might be tempted to blame Aunt Karen's obsession with knitting or her love for reality TV, it's important to remember that depression is a complex beast with many contributing factors. 1. 2 common symptoms of depression. Depression doesn't come with flashing neon lights and a sign that says, "Hey, I'm here." Instead, it often sneaks up on people and wraps them in a suffocating haze of sadness. Some common symptoms include persistent sadness, loss of interest in once enjoyable activities, changes in appetite and sleep patterns, fatigue, and feelings of worthlessness or guilt. It's like having a personal rain cloud that follows you everywhere. Except instead of rain, it's raining negativity. 1. 3. The impact of depression on the individual and the family. Depression isn't just a solo act. It's a whole family affair. When someone in your family is dealing with depression, it can take a toll on everyone involved. The individual might experience difficulties in their relationships, work or school performance, and overall quality of life. And for the family, it can be like navigating a minefield of emotions, trying to support their loved one while also dealing with their own feelings of frustration, confusion, and worry. It's like playing emotional Jenga, where one wrong move could bring the whole tower crashing down. 2. Recognizing depression in a family member. Signs and communication. 2. 1. Behavioral and emotional signs of depression. Recognizing depression in a family member can be a bit like trying to solve a mystery. You have to look for clues in their behavior and emotions. Some signs to watch out for include persistent sadness or irritability, withdrawal from social activities, changes in appetite or sleep patterns, difficulty concentrating, and feelings of hopelessness or worthlessness. It's like trying to decode a secret message, except instead of cracking the Enigma code, you're deciphering the enigma that is depression. 2. 2 Effective communication strategies. Communication is key, especially when it comes to dealing with a depressed family member. But it's not as simple as yelling from the other room, "Cheer up, Buttercup." Effective communication involves active listening, empathy, and patience. It's about creating a safe space where your family member feels comfortable opening up about their feelings. So put on your best listening ears. Leave your judgment at the door. and let them know that you're there for them, no matter what. 2. 3. Overcoming barriers to communication. Sometimes communication can feel like you're playing a game of telephone with a bad connection. It's frustrating, confusing, and often leaves you wondering if you're speaking the same language. But fear not. There are ways to overcome these barriers. Start by being patient and understanding that your family member might find it difficult to express their feelings. Be supportive and non-judgmental, and try to find alternative ways to communicate, such as through writing or engaging in activities together. Remember, it's all about finding a way to bridge the gap and let them know they're not alone. 3. Supporting a depressed family member. Empathy, love, and patience. 3. 1. The importance of empathy in supporting a depressed family member. Empathy is like a warm hug for the soul. When supporting a depressed family member, it's essential to put yourself in their shoes and try to understand what they're going through. It's about validating their feelings and letting them know that you're there to support them, no matter what. So channel your inner empathetic superhero and be their emotional sidekick. 3. 2. Expressing love and emotional support. Love is the secret ingredient that makes the world go round. And it's also a powerful tool for supporting a depressed family member. Expressing your love and emotional support can be as simple as giving them a hug, sending an encouraging text, or just listening to them when they need to vent. It's like slathering them in a cozy blanket of love and reminding them that they are cherished. 3. 3. Practicing patience and understanding. Patience is a virtue, especially when you're dealing with a depressed family member. It can be frustrating when they cancel plans last minute or seem distant. But it's important to remember that depression is not something they have control over. Practice patience and understanding. And remember that it's a marathon, not a sprint. Be their cheerleader, even on the days when it feels like the finish line is nowhere in sight. 4. Encouraging professional help. Therapy, counseling, and medication. 4. 1. The benefits of professional help. Sometimes it takes a village, or in this case, a team of professionals, to help manage depression. Encouraging your family member to seek professional help can be a game changer in their journey towards recovery. Professionals can provide guidance, support, and evidence-based treatment options that can help your loved one better navigate the dark waters of depression. 4. 2. Types of therapy and counseling options. Therapy and counseling aren't just for people who resemble Dr. Phil. There are various types of therapy and counseling options available that can be tailored to meet your family member's specific needs. From cognitive behavioral therapy, CBT, to interpersonal therapy, IPT, and everything in between. There's a modality out there that can help them make sense of their emotions and develop healthy coping strategies. 4. 3. Medication as a treatment option. Medication can be like a trusty sidekick in the battle against depression. For some individuals with more severe or persistent depression, medication prescribed by a healthcare professional may be a necessary part of their treatment plan. It's important to approach medication with an open mind and have an open dialogue with the healthcare provider to weigh the benefits and potential side effects. Remember, not all superheroes wear capes. Some wear prescription pads. So, my dear readers, supporting a depressed family member may feel like navigating a roller coaster of emotions. But with understanding, communication, love, and professional help, you can be their superhero in their fight against depression. Remember to take care of yourself too. Because you can't pour from an empty coffee cup. Stay strong and keep that wit and personality shining. Support and enjoying personal time. 8. Seeking professional help. When to consult a mental health professional. 8. 1. Recognizing signs for professional intervention. 8. 2. Finding the right mental health professional. 8. 3. Supporting your loved one in seeking professional help. 5. Creating a supportive environment. Nurturing physical and emotional well-being. 5. 1. Establishing a safe and understanding environment. Living with depression can be incredibly challenging. So it's important to create an environment where your family member feels safe and understood. Be patient, empathetic, and non-judgmental when they express their feelings. Listen actively, and let them know that you're there to support them. 5. 2. Encouraging healthy habits and lifestyle changes. A healthy lifestyle can have a positive impact on mental well-being. Encourage your loved one to adopt healthy habits like eating a balanced diet, getting regular exercise, and maintaining a consistent sleep schedule. Offer to join them in these activities, making it a bonding experience and promoting their overall well-being. 5. 3. Promoting emotional well-being through activities and hobbies. Engaging in activities and hobbies can be a great way to uplift someone's spirits. Encourage your family member to pursue activities they enjoy and find fulfilling. Whether it's painting, gardening, or playing an instrument, these activities can provide a sense of purpose and joy, helping to alleviate some of the symptoms of depression. 6. Building a strong support network, involving friends, relatives, and community. 6. 1. Engaging the support of close friends and relatives. Dealing with depression shouldn't be done alone. Reach out to close friends and relatives who can offer support and understanding. Share with them what your family member is going through and let them know how they can help. Having a strong support network can make all the difference in helping your loved one feel less alone. 6. 2. Seeking professional support groups and community resources. In addition to friends and relatives, consider seeking out professional support groups and community resources. These groups can provide a safe space for your family member to share their experiences and learn from others who have gone through similar situations. Local mental health organizations and online communities can be excellent resources for finding these support groups. 6. 3. The benefits of peer support and encouragement. Connecting with others who are going through similar challenges can be incredibly empowering. Encourage your family member to seek out peer support groups or online communities where they can receive encouragement and advice from others who truly understand what they're going through. Peer support can foster a sense of camaraderie, which can be a powerful tool in their journey towards recovery. 7. Self-care for caregivers. Managing stress and seeking personal support. 7. 1. Recognizing the importance of self-care. Taking care of your own well-being is crucial when supporting a depressed family member. Recognize that you can't pour from an empty cup and that you also need self-care. Prioritize activities that bring you joy and help you relax. It's not selfish. It's necessary for your mental health and ability to be there for your loved one. 7. 2. Managing stress and burnout. Caring for someone with depression can be emotionally and physically taxing. Look out for signs of stress and burnout, such as exhaustion, irritability, or withdrawal. Take breaks when needed and find healthy coping mechanisms like exercise, meditation, or talking to a friend. Remember, you can't support others effectively if you are not taking care of yourself. 7. 3. Seeking personal support and enjoying personal time. Don't hesitate to seek support for yourself. Talk to friends. Join support groups for caregivers. Or consider talking to a therapist. Having someone to confide in and share your own struggles can be incredibly comforting and helpful. Additionally, make time for activities and interests that bring you joy and allow you to recharge. Taking care of yourself ultimately benefits both you and your family member. 8. Seeking professional help. When to consult a mental health professional. 8. 1. Recognizing signs for professional intervention. While your support and love are valuable, there may come a point where professional intervention is necessary. Some signs that it's time to consult a mental health professional include a lack of improvement despite your efforts, persistent thoughts of self-harm or suicide, or a significant decline in their daily functioning. Trust your instincts and seek professional help when needed. 8. 2. Finding the right mental health professional. Finding the right mental health professional for your family member is crucial. Research different therapists, psychologists, or psychiatrists in your area and consider their experience and specialties. Ask for recommendations from trusted sources, such as your family doctor or local mental health organizations. Finding a professional who clicks with your family member is key to their progress. 8. 3. Supporting your loved one in seeking professional help. Approaching the topic of professional help can be delicate, but it's important to express your concern and support. Let your family member know that seeking help is a sign of strength, not weakness. Offer to assist them in finding a professional. Schedule appointments, or even accompany them to their sessions if they're comfortable. Your unwavering support can make a world of difference. In conclusion, dealing with a depressed family member requires understanding, patience, and empathy. By recognizing the signs of depression, fostering open communication, and creating a supportive environment, you can make a significant difference in their well-being. Encouraging professional help, practicing self-care as a caregiver, and building a strong support network are crucial aspects of the journey. Remember, you are not alone in this. Reach out for assistance and lean on others for support. Together, we can navigate the challenges and provide the love and understanding that our depressed family members need to find hope and healing. Frequently asked questions. 1. How can I tell if my family member is experiencing depression? 1. 1. What are the common signs and symptoms of depression? 2. Should I talk to my family member about their depression? 2. 1. How can I approach a conversation about depression with empathy and understanding? 3. What can I do to support my depressed family member? 3. 1. Are there specific actions or behaviors that can be helpful in providing support? 4. When should I encourage my family member to seek professional help? 4. 1. What are the available treatment options, such as therapy and medication?